Our hospitals are at or over capacity. Many of our nursing homes are closed to new admissions because they don't have the staff to care for them.
News 10 NBC investigative reporter Jennifer Lukey has been reporting on the healthcare crisis in our community for months. Tonight she presses the lieutenant governor for answers that were promised by his boss. Jen?
Well, Brett, Deanna, I went to a press conference with Governor Kathy Hochul. She held it in Buffalo last week to ask her about these staffing shortages because when she implemented the vaccine mandate for healthcare workers, she said there were staffing resources available for hospitals and nursing homes that were impacted. She told me she was going to get back to me with the information on whether she was going to actually provide that help and when. I never heard back, so today I asked again.
Twice last week, Thompson Hospital in Canandaigua was so overwhelmed with patients it stopped accepting new ambulance arrivals.
First time in my career we've gone on diversion here, and on Tuesday Tuesday and Thursday we did it for the same exact reasons, and it was all about volume and the amount of patients coming in, and not just the patients but the acuity of the patients.
Noise Health in Dansville hasn't had to go on diversion yet but is experiencing the same surge.
Today I can tell you we have 50 inpatients plus 6 patients who are boarding in the ED. 5 of those on ventilators, 22 of those are COVID positive.
Healthcare workers are at their breaking points.
But it's not even about money anymore. I mean, these folks are they're pulling double shifts, they're extending shifts, they're taking time away from family. And, now the volume is so high, there is no break, and it is room to room, PPE all day long.
As we've reported, the same is true at the big hospitals in Monroe County, too.
This isn't a hospital problem. This is a nursing home problem.
Yeah.
I have 17 patients out of 113 who are sitting in our hospital who are totally stable, who need nursing home placement, and there's nowhere to send them.
There are another 200 in Rochester hospitals waiting for placements right now, too. And that's because dozens of local nursing homes are too short-staffed to take care of anyone else.
I asked the governor about this last week. She was going to get back to me.
Lieutenant Governor Brian Benjamin was in Rochester today, so I tried following up with him on what the state is doing to help. But he quickly deferred me to Monroe County Executive Adam Bello.
Our hospitals are saying they are near crisis. So is the state yet prepared to do anything about that?
The state is prepared, but why don't you jump in terms of how we've been communicating on this issue.
The county executive went on to talk about what we already know.
It's really about nursing homes. It's about increasing nursing home staffing levels, and that's going to take time. That's not something that you just flip a switch on. But
is that being worked on from the state level? We've heard the county executive talk about this, but we haven't really heard the governor or the administration say, okay, we're going to do this, 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 and this to fix it then.
Well, I don't have answers on this, this, and this, but I do know that our Department of Health is working on and discussing the issue. So I will talk to the governor when I leave here, let her know that I have been asked this question that you have asked her as well, and we will be in touch in a serious way.
I have not heard back yet from either the lieutenant governor or the governor, and I'm sure I'm getting annoying here, but staffing shortages in our healthcare system affect everyone, and particularly those people who are working these long hours trying to care for those of us in this community. When I do hear back, I will let you know. Deanna.
We know you will.
Keep asking them.
Thanks so much.